Assalamu alaikum and good afternoon. So today our discussion is going to be about the topic sterilization, disinfection and asepsis. See, the word sterilization and disinfection, it means like to have a very clean environment. When we do treatment for patients, we want all the instruments and all the clinical setting and everything to be clean. It is not just clean, but also free from any bacteria, viruses, or fungi. So free from any microorganisms. So this is the concept of asepsis. Sepsis meaning infection. Any bacteria getting into the body and causing an infection is called sepsis. Asepsis is the opposite of it. So we are trying to achieve asepsis or a non-septic environment by doing sterilization and disinfection. And this is the key aspect of any surgical treatment. Whatever may be, it can be oral surgery, it can be general surgery, it can be orthopedic surgery. All the instrumentation, all the clinical setting, everything should have been either sterilized or disinfected, and that is going to be the focus of discussion in today's lecture. Why we need to do sterilization and disinfection in a clinical setting? Because there are several routes of spread of infection. It can spread from patient to the dental healthcare professional. It can spread from the dental healthcare professional to the patient. But most importantly, it can spread from one patient to another. Say you have patient A and patient B. Patient A has an infectious disease. You do the treatment. You just wash the instruments with only soap and water. You do not disinfect or sterilize it. You use it again in patient B, which of course is a crime. And if you use it, there is a risk of spreading the infection from patient A to patient B. So this is the idea why we have to do the sterilization and disinfection. Well, you might be wondering why I'm giving you this example. But the reason is, like 50 or 60 years ago, the concepts of sterilization and disinfection were not as much as what we are discussing today. 100 years ago, people were not even wearing gloves when they were doing extractions. They were just simply doing it with bare hands. And instruments would barely be washed with soap and water, and they will put it in boiling water. And that's the maximum amount of disinfection, I would call it. It's not sterilization. That's the maximum amount of disinfection which you could expect in a dental clinical setting. But today, science has advanced and we know more about the microorganisms and the risks of infection and the spread of infection from patient to patient or from patient to dental practitioner or vice versa. So we are following the concepts of sterilization and disinfection religiously. So that is going to be the focus of discussion in the subsequent parts of today's lecture. Before we go about reading about sterilization and disinfection, we need to know certain important definitions. So what is sterilization? What is cleaning? What is decontamination? And all of those things. So cleaning is basically a process of removing the visible dirt. For example, you take an example of an extraction forceps. After extraction, you will see the blood contamination on the surface of the forceps. So you just clean it with a saline soaked gauze, or you use soap solution and a sponge to clean it. So this is basic cleaning. Cleaning is a prerequisite for disinfection and sterilization, but it is not a replacement for disinfection or sterilization. Remember that. As I told you earlier in the first slide, asepsis is a term used to describe methods which prevent contamination of wounds and other sites by ensuring that only sterile objects and fluids come into contact with them. So these are important definitions that you should know. So asepsis as a concept is what this means. So wound should not be contaminated by any dirty instruments. Or you should only use sterile instruments when you are treating a wound. So the concept of antisepsis is the procedure of application of an antiseptic solution, which will inhibit the growth of microorganisms. So when you put a hand sanitizer, or you have a Savlon solution or a Dettol solution, which is an antiseptic solution to clean a wound, basically it doesn't kill all the microorganisms, but it only kills or inhibits the growth of microorganisms. So and you are just cleaning that area, and you are letting the body's immunity to take care of things further. Disinfection is a process which reduces the number of viable microorganisms to an acceptable level, but it cannot inactivate some viruses and spores. Sterilization, on the other hand, is the process of destruction of or removal of all microorganisms from an instrument, an article, or a surface, including spores. So this is the major difference between disinfection and sterilization. In sterilization, it includes the removal of all organisms, including the spores, bacteria, and fungi, when they are exposed to extreme conditions, that is non-livable conditions for the bacteria or the fungi, they form what is called as spores. These spores are extremely resistant to heat. They are extremely resistant to exposure to chemicals, radiation, and everything. And when a favorable environment occurs, these spores germinate into vegetative bacteria, and they can actually form a bacterial colony, and they can cause a septic infection. So the idea of sterilization is to kill even these spores, whereas disinfection is only to remove the living organisms. So you are not targeting the spores in a disinfection. So for this matter, we actually have to see what are the different types of instruments that we will be using in a dental clinic, especially in an oral surgical setup. And depending upon the instrument type, we have to decide whether it requires sterilization or disinfection, or it should be the both, or whatever it is. Some other definitions include sanitizing, which includes the process of reducing the microbial population on an object to a safe level. So this is usually done for surfaces, non-contact surfaces. And decontamination is the process that removes pathogenic microorganisms on an object to make it safe to handle. So these are the definitions that we have to know. So resistance of microorganisms decides the type of sterilization or disinfection that we do. So if we take the case of some vegetative fungi and bacteria, they are liable to be killed with just simple low-level disinfection. Whereas if you take the case of spores, they require sterilization. So depending upon the type of viruses or bacteria, we either do a low disinfection, intermediate, high disinfection, or sterilization. So this is one criteria. The second criteria is the type of dental instruments that we have to use. So depending upon the type of instrument, it can be either critical, semi-critical, or non-critical. So critical instruments are instruments which come in contact with blood. For example, extraction forceps, elevators, periosteal elevators, scalpels, needles, all of these things are critical instruments. They come with blood and the tissue that is inside of tissue, not the surface of the mucous membrane, but the submucosal or the subdermal layers. So they are coming in contact with the blood space, so they have to be always sterilized. There is no questions about it. They have to undergo some form of sterilization before they can be used in a patient. There is another group of instruments which is called as semi-critical instruments, which are used in mucous membranes and non-intact skin. Non-intact skin is like kind of, say, a skin that has an abrasion or cracks, or it is used in mucous membrane. A simple example that I can tell you here is your mouth mirrors. So sometimes when we go for community health checkups, community dental checkups, we do not use a mouth mirror. We do not have enough mouth mirrors to conduct the community or epidemiological dental camps. So we use tongue depressors. These wooden tongue depressors are not sterilizable, but they can be disinfected. They can be soaked in chemical disinfectant solution and they can be used in the mouth. So these are semi-critical instruments which can be used with only disinfection. There is no need for sterilization because there is no risk of spread of infection. Some more instruments are there which are called as non-critical, and they come in contact with only intact skin. Intact skin is like the skin which has no injury or no abrasions or cuts. The example that I can give you in the dental armamentarium is the dental chair itself. The dental chair is a non-critical instrument because the patient is sitting on top of the dental chair. The armrests come in contact with skin of the patient. So for these kind of things, we either do a decontamination or a low-level disinfection. We just put some low-level disinfectant sprays and clean the dental chairs. So this is the most important criteria that decides whether your instrument should be sterilized, disinfected. If it is disinfection, whether it is high level or intermediate or low level disinfection. Here you see examples of critical instruments like dissecting scissors, your extraction forceps, your elevators, your explorers and probes which come in contact with skin. Semi-critical instruments include mouth mirrors, tweezers, which are only holding the cotton, and then some explorers which are used only for examining the hard tissue, the cavities. This is actually an amalgam carrier. It's not a syringe. Don't get confused by this with a syringe. This is an amalgam carrier. So this is a restorative instrument. So these are semi-critical instruments. Non-critical instruments are those that are coming in contact with intact skin, like your glass slab, your eye protection, your PPE kits, rubber bowls, and things like that. So they require only low level or intermediate level disinfection. So to achieve sterilization of any instrument, we need to have 2 or 3 processes that are involved. The first process is cleaning. So I told you in the beginning itself, what is cleaning? Cleaning is like you clean only the soiled parts. Any visible soiling, any visible dirt on the instruments has to be cleaned. So that is pre-sterilization cleaning. The second process is sterilization. And the third one is after sterilization, you should not expose the instrument to the outside environment until it is used on a patient. So you have to store it in a safe place, and this we call it as aseptic storage. Depending upon the type of sterilization that we can do, there are mainly 2 categories. One is either physical or the other one is chemical. In physical, we have heat, then we also have mechanical dislodgement, and then we have radiation. So, and in chemical, we have antiseptics, disinfectants, and the ethylene oxide gas. So first, let us look at the physical. Before that, we look into the pre-sterilization cleaning. So usually the objective is to clean any soiled instruments. So there are 3 ways of cleaning it. Either you can do a manual cleaning or an ultrasonic or mechanical washing. The manual cleaning has a risk of injury to the patient, so we avoid it. The olden days it was being done, but currently what we do is either an ultrasonic cleaning, which uses the principle of ultrasonic waves, which causes vibrations to clean the instruments. And the second one is the third one rather, is your mechanical washing, which is similar to your dishwasher. You just put instrument inside, add a detergent, soap kind of material, and then with heavy pressure, the water cleans up the instrument. And once the instrument has been cleaned, then we put it for sterilization. So as I told you, there are 3 types of sterilization. 2 are physical and 1 is chemical. The first one is sterilization by heat, which is a physical method of sterilization. So there are 2 types of heat. Either it is dry heat or moist heat. So dry heat is just you are putting the instrument in a hot air oven. Okay, this generates heat without any steam. So that's the difference between dry heat and moist heat. In moist heat, you generate heat through steam. You boil the water and the water is made into steam, and the steam is used for sterilization. So this is moist heat. In dry heat, there is no role for water. So here you can see what is a hot air oven. Usually this is used for instruments which cannot be exposed to moisture. For example, you have some sharp metallic instruments which when exposed to moisture can get corroded, they can have rusting. So such kind of instruments you can use a dry heat sterilization. So basically you have a heating coil. This is similar to what you have the hot heaters. You have heaters which you use during the winter season in your rooms. So they generate a dry heat. They do not include any humidity in that one. So it is a dry heat, and there is usually a fan which is used to circulate the heat. And this dry heat causes protein denaturation and kills the microorganisms. The other form, as I told you, is the moist heat. In this one, what they do is like the heat is applied to water, and water is boiled to form steam. And this steam is used to sterilize instruments. And not only it's simple steam, it is using steam under very high pressure. What the concept behind this is, they say that when you heat water, okay, it takes up a lot more energy than just heating air. And when you convert the boiling water to steam, it requires even more energy. It requires like 7 or 8 times more energy than that required for boiling the water. So, and when this steam comes in contact with the surface of a microorganism, it condenses. That is, it cools down. It cools down to become water again. At that point, it releases all the stored energy that has been used to heat it up. And this energy is enough to kill all microorganisms, including spores. And this is the only sure shot sterilization mechanism in the physical means to kill spores. And when you apply pressure, what they say is like when you, instead of giving steam at the atmospheric pressure, the normal atmospheric pressure, rather than that, you let it build up pressure, like how it happens in a pressure cooker. When you let the pressure build up, this enables sterilization even in a faster way. So that is the advantage of using an autoclave. So usually it has a very high penetrating capacity. It gives large amount of heat to the surface to which it comes to contact, and you can achieve sterilization within a very short time. They say that within 15 minutes you will be able to get sterilization, provided you are using the steam under very high pressure. Just to give you an example here, you can see this is a slide showing what are the different see, by the way, for every sterilization cycle we call it as a sterilization cycle. You put the instrument in the oven or the autoclave, and then you have to allow the cycle to complete, and only then the instrument is sterilized, so you can take it out. So if you use dry heat at 121 degrees Celsius, it takes 6 to 12 hours for one sterilization cycle. But the same, if you apply it in an autoclave, it just takes 24 minutes. Imagine, it takes almost 25 times more time than what it takes to use in an autoclave. So that is the biggest advantage of the autoclave, because it helps penetrate the heat through moist steam into all instruments. Uniformly it spreads and also kills the organisms, including spores, in a very short time. There are even some autoclaves that use very high temperatures. You can see that at 138 degrees Celsius and under pressure, it just requires a minute and a half to sterilize instruments. So in big hospitals, when they require a rapid turnover of instruments, they need a quick autoclave. They have very small autoclaves which can operate at this high temperatures, and they can do a rapid cycle autoclaving to give you the instrument sterilized. So this is essentially the differences between dry heat and moist heat. Both of them act on the protein part of the microorganisms, and they oxidize or denature the proteins. If you take the time for sterilization, the dry heat takes a longer time, whereas moist heat using an autoclave takes short time. The complexity of equipment, though, is less in the dry heat, whereas in the moist heat it's a little bit complex. And another disadvantage is, like, because of the moisture content, the water content, instruments can rust or get dull. So that's a problem with the autoclave. And availability of the equipment to be used in a dental clinic, in a small size equipment, it is possible with both the dry heat and the moist heat sterilization techniques. So the next method is sterilization by gas. So here, this is not a physical method, rather it is a chemical method. Here you use a gas, which is actually a chemical, which is called ethylene oxide. And this is used for sterilizing instruments which cannot be exposed to heat. For example, if you have something plastic, in the wards, we use plastic tubings for giving the IV fluids. So these kind of plastic tubings cannot be sterilized in hot air oven or an autoclave. So you have to expose them to something that's favorable. You can maintain a good temperature. So for that reason, ethylene oxide is good, because ethylene oxide has some operating temperature in the range of 30 degrees Celsius to 60 degrees Celsius. Usually plastics can withstand that temperature. And at 30% concentration, they don't use 100% ethylene oxide gas because it's highly flammable. It can burn or cause an explosion. So they mix it with carbon dioxide or nitrogen. So 30% is ethylene oxide, and the remaining 70% is either carbon dioxide or nitrogen, so that it doesn't have the inflammable properties. And you have to keep it in the holding period. The sterilization cycle usually takes up to 3 hours. So ethylene oxide gas at an average of 50 degrees centigrade for 3 hours is an effective sterilization for porous materials. You can use gauze, sterilizing gauze or cotton, because if you expose it to moist heat, they can actually become soggy. So you can sterilize them using the ethylene oxide. Materials that are sensitive to heat or radiation, and large equipment which cannot fit into an autoclave, because usually both hot air oven and autoclave, when you go for a bigger instrument size, the equipment also has to be bigger, and which becomes more expensive to operate this equipment. So for that reason, large equipment are easily sterilized using the gas. The only problem is ethylene oxide gas is not available in all places. For example, if you have a dental clinic, you can own a hot air oven or an autoclave, which is easy to maintain. Okay, it doesn't require any major apparatus. You can buy it commercially and set it up and use it in your clinic. But to have an ethylene oxide, you need to have industrial regulations and permissions, because it's a flammable gas. You cannot keep it in a domestic area. It is a risk for all the people around that area. So usually ethylene oxide is available only in big institutions or industrial sterilization, in the manufacturing area, when they manufacture the plastic instruments or things like that. They will sterilize it in the industry and then send it across to the market. So that is the area where they use the ethylene oxide gas. One more physical method of sterilization is using radiation. And I believe you all study about the X-rays. X-rays actually are a type of radiation which can ionize the substances that they come in contact with. Even more powerful than X-rays are gamma rays. Gamma rays are used for sterilization. So this is mainly used for sharp instruments. All the sharp instruments like BP blades, needles, even the injection needles, the suture needles, these are all manufactured in a very high precision process, and even slight exposure to heat can cause blunting of the instruments. So how do they sterilize these instruments? Especially in the place of manufacture, they always use the gamma radiation. So gamma radiation kind of sterilization is normally not used in institutions or hospitals. It is mainly used in the industries. So surgical instruments, when they are new, and also heat and gas sensitive materials are sterilized in this form. So this is mainly used only in the industrial areas, and for where the medical or surgical instruments are manufactured at that point of time, where how it is sterilized. And even graft materials, bone graft materials, and tissue membranes and things like that, they are sterilized using the gamma radiation. So how do we know whether our sterilization is effective or not? We always use some form of an indicator. The indicator could either be a physical indicator, chemical, or a biological indicator. The commonest form we use is the sterilization pouches. So if you look at it here, the sterilization pouch has a green color, and this is a slight brownish color. Once it is exposed to heat or ethylene oxide gas or the steam, which is the moist heat, it turns color to dark brown, black or blue, and this one also turns color to somewhat like a brownish, dark brownish color. So these are the sterilization indicators. Same way, you can also put a sterilization indicator strip into your sterilization packet, and it is usually having no color when you initially place it in the autoclave or the hot air oven. But once you finish the cycle, this entire thing should have turned black. So these are sterilization indicators which help us to know that the sterilization is done properly. And the last step in managing our aseptic instrument handling is aseptic storage. So until the time the instruments are used for patients, we have to store it in a safe place without contamination or getting them infected. So instruments are usually wrapped. So this is how we usually wrap the instruments. You can see a double wrapping. You can see that the forceps is packed in one wrap, and this wrap is put in a second wrap. So this double wrapping helps accidental exposure of the sterilized instrument, and also another reason is like it helps in handling out the instruments. So for example, in a clinic, the assistant is giving you the instrument and you are clean, you are wearing sterile surgical gloves. So they will just touch the outer wrapper, open it, and give you the instrument with the inner wrapper, and you will open it from the inner wrapper so that you are not touching any of the contaminated surfaces. So this is the idea behind the double wrapping technique. Sterile packs must be handled as little as possible. So if once it's sterilized, you have to put it in a tray in a storage area. And also, you cannot leave it for an endless amount of time, considering that it is sterile. Like say, for example, after 2 or 3 weeks, you have to re-sterilize it if you have not used the instrument. And all sterile plaques should be allowed to cool before storage. To prevent contamination from rodents or other kinds of parasites, the store must be subjected to adequate pest control, and the material should be stored at least 8 inches off the floor and 18 inches from the ceiling. So this is actually a material safety regulation. And sterile plaques must be stored and issued in correct date order. So this is what I told you, the one that is sterilized first is issued first. So what you sterilize, for example, you have sterilized today, tomorrow, and day after tomorrow. When the patient, when a clinician comes to take an instrument on Sunday, you should first give the instrument that was sterilized first, that was sterilized today. So only after that you will give the instrument that are sterilized later on. The next important method of sterilization, rather I would call it as disinfection, is chemical methods. So why we call it chemical methods? Disinfection is like, in sterilization, our target is to remove even the spores. But whereas when we do a chemical method, to remove the spores is possible, but it requires longer exposure time, and the chemical that is used should be really very concentrated. So such a concentrated chemical, when an instrument is placed in such a concentrated chemical for a very long time, you may not be able to use the instrument directly on a patient. You have to clean it then. You have to clean it with clean saline or something and only then use it. So this all compromises the sterile issues. So that is why anything when we use a chemical, we always call it as a disinfection. So no available chemical solution will sterilize instruments immersed in it. So secondly, there is a risk of producing tissue damage if residual solution is carried over into the wound while it is being used. So for these reasons, all chemical methods are disinfectants. And how they act is, like, in general, they all act by causing cell membrane injury to the bacteria, viruses, or the fungi. And also they can cause coagulation of the bacteria. And they also interact with the functional groups of proteins to destroy their structure. In general, the chemical disinfectants can be classified into three types. One is low disinfection, the other is intermediate, and the third is high disinfection. So the low disinfection, it acts against all vegetative bacteria and lipid viruses. For example, your COVID-19 virus, this requires only low disinfection because it is a lipid enveloped virus. A simple soap wash or using alcohol hand sanitizer can denature the cell structure of the virus, and it makes it deactivated. So such kind of viruses, this is an example that I'm giving you. Okay, so normally what we do, the low level of disinfection is only for non-contact surfaces. For example, in a clinic, you have a table, you have your computers, you have your keyboards, mouses, the pens and stationary equipment. These are all non-contact, non-critical areas. So these ones, they require low level of disinfection. The intermediate level of disinfection, it kills vegetative bacteria, lipid and non-lipid viruses, and also tubercle bacilli. So usually the intermediate disinfection is used for all semi-critical. Okay, so semi-critical areas include your any kind of instruments that is going to come in contact with mucosa, the dental chair surfaces, the light handles, because the gloves touch them and then the patient is coming into contact again with that. So for that reason, these will require intermediate disinfection. High disinfection is for all instruments that come in contact with the tissues and blood. So high level disinfection is capable of killing the bacterial spores, but as I mentioned to you, very rarely we use this high level of disinfection as a form of sterilization, because it cannot 100% cure it, because all chemicals are susceptible to environmental degradation. For example, you put 10%, say, I'm going to give you a chemical disinfectant which has to be maintained at 10% concentration for 3 hours to give you the optimum sterilization effect. But the 10% concentration, when you change the temperature, when the surrounding temperature is hot or cold, it can degrade. The material can degrade. So the 10% concentration, even it becomes 9.5%, the effectiveness is lost. Same way, the temperatures, the timing that you are keeping it. If you say 3 hours, it has to be strictly 3 hours. And for that 3 hours, this concentration has to be maintained. So the parameters or the technical issues with maintaining chemical sterilization are very difficult. And the second issue is, like, when you take this instrument and use it on a patient, residual solution chemical can cause damage to the patient's tissues. So for this reason, as I mentioned to you once again earlier, chemical methods are usually only for the disinfectant. There are several materials that are available. You have formaldehyde, glutaraldehyde at different concentration, chlorine compounds, iodophores, and things like that. So depending upon the exposure, it can be either an intermediate or high level of disinfection. So this is actually for the different instruments, what kind of sterilization that is required. If you look at it, most of the metallic instruments and those instruments which come in contact with tissues, we have to do a steam autoclave. And whenever it is susceptible to moist heat, then you can do a dry heat kind of sterilization. And if permissible, you can do a chemical disinfection. So in the operation theater, okay, so there are two types of environments that we follow. So what we do in the dental clinic, we call it as a clean environment. So we are not expecting an antiseptic environment. We are not expecting zero microorganisms or very minimal microorganisms. We just expect clean technique. So what we do is, like, we are not using sterile gloves. Rather, we are using clean gloves, but only our instruments which are coming in contact with blood are sterile. But if you take the case of operation theaters, when we go for major surgical procedures, we have something called as an antiseptic or aseptic technique. So in this one, what they do is like every team of the operator or the assistant who's touching the patient doing the procedure is completely sterile. They wear sterile aprons, they wear sterile gloves, their goggles and everything should have to be disinfected. And the people who are actually handling the instruments, as I told you, they use the double packing technique. They open the first pack and then they, without touching the area, they give the inner part alone is taken by the sterile group of people. So they usually divide this antiseptic environment into several zones. The outer and general access zone usually is the patient reception area and general office where anybody can go. The clean or limited access zone is only, if you are going into the clean or limited access zone, you should be wearing these scrubs. The scrub suits, you have to wear it. And then the restrict access zone is the operating suites, where you have the operation theater, the operating team and the anesthetist and those people. And then the aseptic or operating zone is that team of people who are surrounding the patient. So you are classifying them into different zones so that you are maintaining several levels of antisepsis or asepsis so that you are preventing any kind of infection to the patient. To achieve an antiseptic environment, one of the criteria is to have a hand wash. Okay, we classify hand wash into three types: the social, clinical, and the surgical hand wash. The social hand wash is the simple one that we do at homes and offices. Plain liquid soap is used, and any time before you eat or do this. So in the COVID-19 anti-COVID protocols, we all learned about what is the social hand wash, a 20-second hand wash with a good soap. Clinical hand wash is used before clinical procedures. Usually we use an antimicrobial soap, and usually we do not scrub, we do not wash up to the elbows. We usually wash only up to the wrists in this one. Whereas when you go for a surgical hand wash, you have to use an antimicrobial skin cleanser, and this has to be something like chlorhexidine or povidone iodine, which can kill bacteria. And moreover, when you wash it, you have to wash till your elbows. Okay, so this is what we do in the aseptic technique in the operating theaters. You have to do a wash before, and this is mainly done before you wear the sterile apron and the sterile surgical gloves. And in addition, there is also something called a surgical scrubbing. So scrubbing is usually preparation of the site of the surgery, so where you have to clean it with these kind of antimicrobial solutions before you can actually do the operating procedure. So this is actually the technique to wash your clinical hand wash. And after washing, you wear your apron and you make sure that you do not touch any of the frontal area, which is the sterile areas. And you will have someone to help you tie up the apron from behind. And even before you wash your hands, you should be attired with the other PPE kits. Your head caps, goggles, and masks should be the one to be worn first, and only then you go for a hand wash. And after hand washing, you wear the apron, and then you have to wear the gloves. So this is the method of wearing a surgical sterile gloves. If you open it, all the gloves are folded inside out. So if you look at it, this operator, he is taking the right glove, he is touching the inner surface here, and then without touching this area, this is considered the sterile area, which never comes into any skin contact. He is just wearing the gloves without touching this area. The next slide, if you look at it, for the second glove, he is putting it in that pocketed area, so that he is not contacting this particular area, and then wears the glove. So this is a technique of wearing the surgical glove, so that this surface, this surface of the gloves, which is coming into contact with tissue and blood and everything, is 100% sterile. And finally, after you use any kind of sharp instrument, you have to make sure that you do the scoop technique to close them. This is also an essential aspect of an aseptic technique. Never cap your needle. If at all you have to cap your needle, do the scoop technique. This is the needle cap and this is the needle. So you have to use the needle as a scoop to pick up the cap and then close it. And then once it is finished, you have to discard it into the sharps container. So these are some essential aspects of sterilization, disinfection, and asepsis in the oral surgical clinic. And this was mainly focused in terms of the oral surgical procedures, extraction, and other things. And the general concepts are almost the same. Mainly we follow sterilization for all instruments that come in contact with tissue surfaces. And any kind of instrument that is non-contact, then probably we can do a disinfection, which is usually by the chemical means. And in sterilization, we have three types. We have the heat, we have the gas, and the ethylene oxide gas, and the radiation. The heat is the commonest method used, and of that, autoclaving or moist heat is the best one. And ethylene oxide gas is used for instruments that are susceptible to heat, and it's usually used in institutional setups and not in small kind of clinic setups. The irradiation using gamma rays is used in the industrial setup, wherein sharp instruments like blades, surgical blades, needles, needle hole, the injectable needles, the injection needles, as well as the suturing needles, all these kind of sharp instruments are sterilized in the industrial area at the point of manufacturing. And chemical disinfection, we have the high, intermediate, and low. High is usually used for critical and semi-critical instruments. For non-contact surfaces or non-critical instruments, we either use an intermediate or low grade disinfection, chemical disinfection. And I also told you about the aseptic technique, which we follow. And important is to store the instruments in an aseptic way after we do the sterilization. And we all need to know how to handle these instruments. With that, we come to the end of this lecture.